evaluate is his musculoskeletal system. So if I haven't already appreciated him walking and trotting, maybe around the exam room or as you're collecting your shelter dog from the kennel, now would be the time to do so. I already did, so I've already determined I'm not seeing any obvious lameness with him. So I'm going to move on to palpation. So I'm going to start with his spine. So I'm going to look at his neck first, and I'm just going to palpate his vertebra along his cervical vertebra here. And I'm just going to go one vertebra at a time. I'm not feeling any asymmetry. I'm not feeling any pain. He's not wincing. And then I'm going to flex laterally, and then to the other side, and then hyper extend and hyper flex here. And I'm not seeing any pain. Nice normal range of motion there. For some dogs that do appear to have some neck pain, I won't use manual pressure. I will just have them spontaneously. So I will offer snacks, and you can see he easily brings his head in every position, showing that there's no overt pain associated with his neck. I'm going to move on to his thoracic vertebra. So again, just going to move along those dorsal spiny process, each one, and I'm going to feel around for symmetry. He should have nice musculature evenly amongst his epaxial muscles. Moving on to his lumbar, his sacrum, and then I'm going to assess his coccygeal vertebra. Just do a little gentle pull up and down. No pain associated with lifting the tail. And then if I haven't already done so, I'm going to run my hands just along his thorax and make sure that there's symmetry along his ribs and musculature. And I'm feeling nice, normal symmetry there. Secondly, I'm going to evaluate each limb and every appendicular joint. So all the joints, which may be tedious, but you don't have to spend too long. We're not doing a full orthopedic exam here for our 715 and 725 courses, but I do want you to know how to approach it. So when I am doing a limb exam, I want to make sure he's well supported, which Natalie is supporting. I don't want to just quickly pull one leg up and have him fall. So we're on the same page. He's supported. I'm going to lift up this first limb here, his right thoracic, and I'm going to just gently flex and extend his digits. And then I'm going to move on to his metacarpus, into his carpus, into his elbow, and note that I'm trying to stabilize all the other joints. So I'm not flexing everything all at once because I'm trying to isolate and make sure that each joint is being examined. And then I'm going to move on to his shoulder one more time, buddy. Just going to gently move his limb forward and back. And things I'm noting for during this is I want there to be normal range of motion, no pain associated with flexion or extension. I'm not feeling any Rice Krispies, so crepitus. I'm not feeling any heat. I'm not feeling any edema, which is inflammation in the tissue itself. I'm also not feeling any effusion, which is inflammation in the joints. And again, notice that I started distally and worked my way proximally, and that's going to help me isolate each joint one at a time. I'm going to move on to his pelvis and do the same thing there. And I'm going to just gently, and of course he's going to be sensitive with his toes, just gently flex and extend his digits, his metatarsals, his tarsal joints, his hock, and then I'm going to help kind of stabilize this and see if I can extend and flex his stifle, and then same with his coxofemoral joint or his hip. See how I'm just gently moving it cranially and caudally. I'm not trying to force him into a position. I don't want to cause pain. I'm just trying to explore and find pain if there is any. And then also, I'm going to just rub my hands down and make sure there's no heat, edema, or effusion. Other things I want to do is check their conscious proprioception. So I'm going to do this with all their limbs. What that is it's just going to be me flipping over his foot, and he should right it and meet it. And you can see he is so good with his conscious proprioception. He's not even allowing me to flip his paw over. So I'm going to try it in this front end here to see if he'll. And you can see he uprighted that very quickly. Try it one more time. It should be repeatable. So if you had a little bit of a delay, or maybe you put it there and they didn't move it at all, so a completely absent conscious proprioception, I want to make sure it's repeatable at least 3 times before I say yes, this is a for sure delay or absent CP. What conscious proprioception is evaluating is, does the dog know where their limb is in space, and can they do anything about it? Sometimes it can be so painful that this isn't a neurologic dysfunction, but they're so painful that they just don't want to move it. I have had dogs that have had cranial cruciate ruptures, and I will, as I'm trying to figure out what the problem is, I'll check their CP and they'll keep it back there because they're so painful. So, be mindful of other factors that may be affecting your conscious proprioception. So we want to check for symmetry. So of course, what we do on the right side, we need to do on the left side. So make sure for your exam that you are checking both left and right sides, front and back. And that concludes our musculoskeletal exam.